Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, October 22nd, and this is our COVID briefing. We've now had 1,871 cumulative positive cases in Missoula County to date, with a record 89 new cases since yesterday. We've had 1,228 recoveries and 9 deaths. 12 Missoula County residents and 11 non-county residents remain hospitalized in Missoula County. We now have 634 active COVID-19 cases, and we have currently identified over 1,500 close contacts. Those active cases and their close contacts remain in isolation and quarantine and are being supported as needed. Remember that all of these numbers, as well as the graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 25,640 cumulative COVID cases, which is up a record 932 new cases since yesterday. There are now 9,096 active cases with 353 hospitalizations across the state. There have been 278 deaths related to COVID-19 statewide. The University of Montana has had 278 cumulative UM-associated cases since the beginning of fall semester, which is up 6 since yesterday. And there are currently 56 active cases associated with the University of Montana. First, I just want to let everyone know that we held a press conference this morning with our partners in the School of Public Health over at the University of Montana. That press conference was held to look at the data on Missoula County cases in more depth. The presentation was recorded and it is posted on our YouTube channel and on our website at missoulainfo.com. I also want to let everyone know that last week, the Missoula County Board of Health formed a COVID subcommittee. That subcommittee met yesterday with our health officer, Ellen Leahy, and I to discuss very specific indicators that we are tracking that will be used to determine when further restrictions will need to be implemented and also when those restrictions will be able to be lifted. Those indicators include looking at our epidemiological profile and whether our cases are ascending, flattening, or descending. We are currently still ascending at an alarming rate. We are looking at the 7-day average daily incidence of new cases, the R value or transmission rate, the type of spread that we're seeing, whether it's from close contacts or community spread. We're monitoring our test positivity rate and the turnaround time to get test results. And we're watching our internal public health capacity in terms of how long it takes to get case investigation and contact tracing done. And we're also watching hospital capacity. We're monitoring community compliance as well as the average number of contacts for active cases. We will be posting these indicators on our website once the document has been finalized and approved. Based on those indicators and where we are currently, there will be new restrictions coming. Working with our Board of Health and elected officials and our team, we're identifying restrictions that will help us to slow the spread. Some of the restrictions being discussed could include reductions in capacity in some businesses in order to increase the ability for people to stay socially distanced, and reduction of the maximum number of people that can gather without distancing. That number is currently 50 under the governor's phase 2 guidance. Currently, the incidence rate in Missoula is too high to allow that number of 50 to go forward. The advisory team is deliberating on how much it should be lowered because there is a benefit to allowing people to gather in structured settings versus unstructured settings. So we're trying to avoid lowering that number to a point that structured social settings would be removed as options. One of the most difficult parts of issuing orders for us and for those who need to comply is to get the order in writing with specific steps and guidance for people. So at this time, we just want you to know that steps are being taken, and we expect to have new orders with restrictions out early next week. Next, I want to talk about hospitalization data. We do keep an eye on our hospital capacity on a daily basis. Here are some of the key points to keep in mind. Missoula County hospitals serve as a regional healthcare hub, so we do have people who come here for all levels of care, from routine to urgent. Our hospitals are still performing elective procedures at this time, so if capacity begins to be limited, they do have the ability to open up more beds by limiting elective procedures, and they do have plans in place and trigger points for when they will need to do that. We stay in close touch with our healthcare partners and will continue to share any pertinent information with you as it becomes available. While we have seen our hospitalizations from COVID increasing in the past week, it was not altogether unexpected. We have seen our affected demographics shift from the younger and generally healthier age groups to now 20% of our cases are in those over the age of 60. So that's going to largely contribute to an increase in hospitalizations. Just know that our hospitals are prepared and they have plans for increased need in our community. Lastly, I just want to talk about Halloween. We've been getting a lot of questions about if we are going to cancel Halloween this year because of COVID. We are not. Instead, we want to share with you some important points as we head into Halloween. First, it's important to follow all of the same prevention measures that we've been taking for the last several months. For those of you wanting to take your little ones out trick-or-treating, take hand sanitizer with you and use it often. Try to incorporate a mask into your child's costume. You should not have them wear a cloth face mask plus put a costume mask over the face mask, as doubling the masking can make it difficult for them to breathe. Make sure that you're maintaining 6 feet of social distancing and keep any interactions with others very brief. Consider attending structured events in the community to celebrate Halloween. These events have precautions in place, so that could be a good alternative. For those who are handing out candy and treats to trick-or-treaters, you should try to limit your direct interaction with trick-or-treaters. Wash your hands before and after handling candy. Do not pass candy out from inside your home. Maybe give out candy from the porch or driveway instead of from the front door. Make sure that you wear a cloth face covering. Only give out commercially packaged candy. Maybe place a table between the person handing out candy and the trick-or-treaters to help maintain 6 feet of social distance. You can get creative. Make a variety of treat bags with commercially packaged candy and hang it from streamers in the yard. Place a bowl or a container of candy at the end of the driveway or walkway with some hand sanitizer and watch from the porch. You can use candy grabbers or tongs to hand out the candy or place it on a table to be picked up. As always, if you're having any even mild symptoms, please do not participate in Halloween this year and get tested. We are encouraging you not to attend house parties or large gatherings, as we are seeing such an increase in COVID cases at this time. You want to limit your interactions with those outside of your immediate circles. We don't want to see an additional increase in the couple of weeks after Halloween. So that's it for my briefing for today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. Check out our website for great information and up-to-date data at missoulainfo.com, and you can call 258-INFO if you would like to schedule a test for COVID-19 if you're having even the most mild symptoms, or if you just have general questions about COVID-19. So until next time, everybody, stay healthy.